Thank you very much, everyone, for joining. I really appreciate this. This is the first time that we have tried doing a press conference this way, so please bear with us if there are any little hiccups as we go. As you know, COVID-19 has really embraced our province. We are in a situation right now where we're on a precipice where we could go down the path where it becomes a major challenge for this province, or if we do some of the things the right way, we'll find that we're able to reduce the rate of infection, and that's what we're trying to do. Over the last 24 hours, a number of things have changed in Ontario. I'm going to start with some of the announcements from Sunday. On Sunday, we made a change to our healthcare system. And what we did there was we suspended some of the collective bargaining agreement provisions that were in there so that we could redeploy healthcare professionals into different areas of healthcare without the delays that we would need under the current system. Just as an example, if somebody wanted to move from one department to another department, it's about a 3-month, possibly 4-month process, and it could include bumping rights. That's not something that is going to be effective as we move forward dealing with COVID-19. So we are suspending some of those collective bargain agreement items so that we have the ability then to move healthcare professionals into the areas where they are most needed in a timely fashion. We don't want to be in a situation where we're short on nurses, we're short on doctors, we're short on personal support workers because the system doesn't allow for us to move people into the areas where we need that extra help. Today, Minister Rickford made an announcement with Premier Ford about Ontario hydro rates. We've heard from a number of different people that with them being self-isolated, they will be using more electricity during the day, and they had asked for some relief on that. One of the things that we have done today then is we have changed the time of use rate so that it is the lowest rate, and it will be that way for the next 45 days. We'll be reviewing it every 14 days. The way that the Emergency Act allows us to do things is to do it on 14-day increments. We're committed to the next 45 days of keeping hydro rates at the lowest amount, and that's because we recognize that a number of people, when they are self-isolated, are not going to be able to be working to bring in the income that they would have had previously. This is going to put some strains on them. And if we can reduce their electrical rates, their gas rates, and ensure that their hydro and their gas can't be cut off, this is something that I think is going to provide relief for everybody in Ontario. Yesterday, Premier Ford announced that we will be shutting down non-essential businesses. The list of essential businesses was released late last night. Most people have reached out to our office. A number of people have reached out to our office to ask for clarification on it. And there have been some questions about some of the groups that are part of this. When you look at supply chain, just as an example, you may be questioning why is, and I'm using some of the examples from Mayor John Tory, you may question why is a glue factory considered an essential service. It's not necessarily the glue itself is essential, but the glue may be used by the box factory. The box factory is producing boxes for hand sanitizer. So when you do it down chain and you look at it, it does start to make a lot of sense why some of those things have been done the way that they have been done. Ultimately, Ontario is in a position right now where COVID-19 could become much worse, or it could be stabilized. We need to have as many people practicing social distancing, social isolation as possible. We have to slow the spread of this disease. There is no natural immunity to it. People, when they come in contact with it, have a high likelihood of contracting the disease, and we want to make sure that we slow that down. Our hospitals have a certain capacity, and we don't want to be in a position where we are over capacity. So we're asking everyone, please take these measures. Help us slow the rate of infection down so that Ontario can deal with this in an expedited manner.